Okay, so yeah, Dr. Nehal Sarja, who I met at the same conference. If you guys were at the beginning, I talked about a conference about a year or so ago that I met Raja, Dr. Raja and Ahmed, and I met Nehal at the same conference. It's ST4 Emergency Medicine, working in the medicine field, and he's got a strong passion both for emergency medicine itself and also helping other doctors who wish to get into that field. So I'm just going to switch Nehal onto the presenter view. Great, fantastic. Thank you, Dr. Sarja. I look forward to this talk.
Awesome. So thank you, Aman, and Arora Medical Education for arranging the IMG conference. We definitely met a couple of years ago in another IMG conference, which fortunately happened face-to-face. But in this COVID-19 pandemic time, well, this is the way we have to go through things. Thank you very much again for calling me here, and welcome everyone who is interested in this IMG conference. And obviously, there are lots of specialties already being discussed. And okay, I welcome you to the emergency medicine side. So, well, yes, I'm working as an ST4 as emergency medicine. I started my career in UK as an IMG, and well, like or unlike many of you, because emergency medicine is not itself a specialty in many parts of the world. So the training, the exams, everything is not very clear to me. So maybe like you or unlike you, I was not very clear about emergency medicine when I landed in UK, but eventually I explored, I loved it, and now I'm doing my training in emergency medicine. So let's roll in. So that's why my first question is, why is emergency medicine? What is emergency medicine? And then the question comes, how we can pursue a career in emergency medicine. So the first question is, we need to know, like any questions comes in front of us, we need to know why. So it is a new specialty in UK and mostly in the western part of the world. And as it's a new specialty, it has lots of prospects. And it is a booming specialty. Now you will find many of the Middle Eastern countries developing in emergency medicine, or they developed already the emergency medicine. So do the Far Eastern part like Singapore, Malaysia, Australia, and the other countries. So the prospect is so good because if you do your training and exams in UK under the Health Education England, then if your options to actually fly to the other part of the world and carry your practice of emergency medicine or improve or develop of emergency medicine of the other parts of the world, the possibilities is too high. Having said so, just to give you an update of the Royal College, who is supporting the training with Health Education England, the Royal College of Emergency Medicine is not an old Royal College like the Royal College of Surgeons or the Royal College of Physicians. It's quite new. And if you try to find back the history, it actually goes back to 50 years. So the college practice is not like 200 or 500 years. It's quite a new college, and the royalty got maybe 5 or 7 years ago. So the specialty is new, so do the Royal College. So when we tell it's a new college, that means the number of people who are working in emergency medicine is not as vast as the people like medicine, general medicine, or surgeons or gynecology people or the other clinicians. So the number of people are still not as high number as them. So it's a small specialty. The number of people are not that large. So a small number of people, they love the specialty, they help each other. So it's a very fantastic specialty. If you like to actually like the emergency medicine, I really welcome and highly recommend this specialty to you. So the next question comes, what is emergency medicine? So the people who is not very clear, what does emergency medicine do? For them, the question comes, is the emergency medicine for me? Because they need to know what is emergency medicine. So I go back to the Royal College Emergency Medicine website. They did an study or some kind of audits that how people who are in emergency medicine, how do they tell about emergency medicine? It's a fantastic slide, I like it, and it is directly from the Royal College website. So they say it's the big thing that you can see in the middle is exciting. Obviously, it is challenging. You will see people mention the dynamic people likes it, and it is never boring because you never know who is the next patient coming through the door, and it is always exciting. And obviously, when you deal a life-saving situation and you manage to save life or lives, it is always rewarding. And the last point that I took here, it is always unpredictable and it is never boring. You will always be amazed with what is your next patient and what kind of challenges that throws to you. And you will always love it because no one expecting in the specialty for you to know everything, but people expect you to act rationally, act logically, use your medical knowledge for the best management of the patient for the given period of the time. So let's roll on to discuss what could be a day in an emergency department as a trainee or as a junior doctor, because that will give you more idea to you, the people who actually never worked in emergency medicine. So let's take it as a day which is a late shift. Oh my, so you might not be very clear what a late shift is. So basically it is, you can tell it as a twilight shift. So in emergency medicine, as the emergency department serves 24/7, and no weekend or anything. So the road, it goes on quite a rota basis. So sometimes you work in the early shift, which mostly work in 8 till 5 or 8 till 6 p.m. The late shift, or the popularly mentioned as twilight shift before, it sometimes goes like 2 to 11 p.m. or sometimes 2 to midnight. Some hospital goes mildly 1 or 2 hours earlier. Some hospital goes to 1 to 2 hours later. And the popular night shift, which goes like 9 to 10 p.m. to till morning, which could be 8:30 or 9 a.m. in the morning. So let's take it like we are going to a shift, which is a late shift. So how does it work? So first thing, you are going to discuss with the lead A&E consultant, or whoever the A&E lead is for the period. You just report to them on the given time, and right away you will start seeing patient. So it is always exciting, as I mentioned, that you never know that what is your patient going to be. It could be a major trauma patient, which is like who are very unwell. It could be a chest pain, which you have to scrutinize further, that well, what you're dealing with. Are you dealing with a chest pain which is coming from heart, or a chest pain which is merely musculoskeletal, or someone coming or sitting normally in front of you with a spontaneous pneumothorax, which needs to be done now, right away. So as I mentioned, that you see patient, you arrange the imaging, the blood test. If it's trauma, you arrange all these trauma calls, and all the people comes. Either you lead the trauma call or you support the leading registrar or the leading consultant of the trauma call. You review all the blood tests, all the imaging reports. Obviously, lots of coffee between patients. You need to be charged continuously. And well, yeah, obviously you'll get enough breaks after every 4 to 6 hours as you need. You do quite a lot of procedures, like as I mentioned before, chest drain tube or shoulder reduction. You do ultrasound quite a lot because it provides a lot of information in a very small period of time. So yes, as I mentioned, that you can do procedures like chest drain, you deal pneumothorax, you do ultrasound, you rule out or you rule in AAA. You deal a lot of fractures, you do nerve blocks like fascia iliaca blocks. Obviously, A&E is most of the time filled with some proportion of crazy people, and A&E never stops. It just goes on, and goes on. You don't know what is your next patient. That is the most interesting or the fascinating part of the emergency medicine. So let's roll on of our today's one of the interesting part, how the training works of emergency medicine, and then we will discuss how you can get into the training program. Getting into the training program is quite interesting because it is quite similar with the previous specialties. As you have gone through the conference, we have already gone through the medicine, IMT, the CST, GP, and psychiatry. So mostly it's not going to be very different, but we will go through it, okay? But first we need to know how this emergency medicine works, because emergency medicine attracts quite a lot of people outside the world in UK. And different people comes with different sets of experience and different sets of knowledge. So why you're going to put yourself in and how you're going to utilize the Health Education England training program ladder, that depends upon your background your background knowledge, experience, and in some case obviously exams. So generally speaking, it's a 6 years training program. So it starts as a CT or ST1 and it finishes as ST6, provided you do only emergency medicine at the end of our slide, we discuss about the possible subspecialties of emergency medicine. But if we talk about only the general part of the emergency medicine, then we will see, yes, it is 6 years. Then, as I mentioned, that the 6 years training program, the Royal College of Emergency Medicine and the Health Education England offers a run-through training. Now, for home, it is not very clear what is run-through training. That means most of the specialties works in like a junior doctor's training program and a higher specialty training program. So some specialties does ST1 to ST3 or CT1 to CT3 as a junior doctor's training program, like the IMT courses now. And as ST4 and above, you do as a higher specialty training. Similarly, emergency medicine is the first 2 or 3 years being mentioned as ACCS. We'll go through it, which generally means acute care common stem, or which is the primary entry point of emergency medicine when you start as CT or ST1. But if you opt in for the run-through training, then you do the interview as CT or ST1, then you just roll on till ST6. Obviously, during the every year you will have ARCP to check that are you getting the enough knowledge and enough experience, which is required by Health Education England and ARCAM. But from ST3 to ST4, they have some defined set of things that you have to acquire in the first 3 years training, which is mostly the junior training in the first 2 years and some junior registrar kind of training in the ST3 or the CT3 area. And when you have attained all the required things for the first 3 years, then you roll on to ST4. But while you are in run-through training, you don't need to go through another interview. The interview is only one. You roll in as ST1, you finish as ST6 or wherever you'd like to go. As I mentioned, that FRCAM have to be finished before becoming consultant or finishing of training. Now, just to give you an forward ideas, because many of you who are seeing or listening to the conference now is going to apply next year. So next year, Royal College of Emergency Medicine is going to bring quite a lot of changes. So a simple or a primary core of change is coming. They are going to bring back their membership exam, which is the MRCAM exam. So MRCAM will be necessary for the trainees to go from ST3 to ST4 and to become the consultant or to attain CCT. FRCAM will be required within that training period of time. And those who are worried about the quite a lot of unusual, unsocial time frames of emergency medicine, LTFT, which is less than full-time training, is a very popular one. And in emergency medicine, while you are a higher specialty training, that means while you are more than ST4, to attain a less than full-time job or a less than full-time position in your rota, you don't even need to explain anything. You just need to let your hospital and let your DNRD know that you'd like to achieve or you like to attain this less than full-time training. They are going to ask that is 80%, 60%, then you can just go through it. So many people who get stressed, who have family, who have some other commitments, still love emergency medicine. Less than full-time training is quite a good one, and quite a lot of higher specialty trainees are now using this less than full-time training. Right, so as IMG, there are 3 areas that you can enter into the training. So the first one, you can start as CT and ST1, which is the full 6 years training, which I am myself is doing, and that offers the CCT and the other things that which was mentioned that here that 5 years training, which used to offer Caesar CP, is now very recently being changed. They can offer CCT as well, so it's not a big thing. But from ST4, possibly it is still offering Caesar CP. Now, if you're not very confident what is the CCT and Caesar CP things, don't worry much. It is the GMC requirement before you become a consultant. So CCT is and the Caesar CP, both thing is a GMC telling the world or telling the trust that you have attained the full training. And obviously, if it's more than 4 years being changed now, you will attain CCT, which is the full training you've been achieved. So as we mentioned that you can start as a full 6 years training. So you start as CT1, ST1. This is an interview. You will go through the ORIA. We'll discuss it later or very soon. And you apply online. Then you go through a face-to-face interview, which used to be happened before COVID-19 time, but now it is happening again through a online Zoom or a Microsoft Team meeting. And so what happens in these 6 years? The first 2 years, as a junior or CT1 and ST1, CT1 and ST2, you will rotate every 6 monthly in 4 specialties. That's which is 6 months in emergency medicine, 6 months in acute medicine, and another every 6 months each for anesthetics and critical care. After the successful 2 years of ACCS, you will roll on to ST3 in emergency medicine. As I mentioned before, that if you opt in for the run-through training, or if you don't opt in for the run-through training, to go to ST3, you don't need to give any other interview. What you have to go through is the ARCP panel, which is a box standard thing for any training program. And if you choose the run-through training, then you will just go through ST4 if you require all the requirements, which I mentioned before is the exam and your set of portfolio requirements. Now the exam from next year is going to be changed from FRChem Intermediate to MRChem. I'm not going in depth there because it's still not in the Royal College website, but if you go to the Royal College website, you will be very sure when the change is coming. The other interesting and quite popular training program for the people who have some background knowledge in emergency medicine. So mostly we can see people who is already working as a registrar or a mid-grade level in the other part of the world or anywhere outside UK. So DREAM program is a fantastic program for them. So you actually enter as a CT3 or ST3 of emergency medicine, and you actually rotate to the same specialties, which is the emergency medicine, acute medicine, anesthetics, and critical care in the first 2 years. So whereas in ACCS, you rotate for 6 months, in DREAM program, you usually rotate for 4 months. So although you are starting your training program as ST3, your first ST3 year will be 2 year long. So you will do all these 4 monthly rotations, and then you will do some months in the emergency medicine. And after the successful requirement of the trainings, portfolios, and exams, you will go to ST4 till ST6. You don't need to apply again to go to ST4 as a higher specialty training. It's a single program. It's a fantastic exception from other specialties because it is actually developed for the people who has some background knowledge of emergency medicine, had some experience in emergency medicine, who don't want to go through all the ACCS route. This is for them. Now, if you have quite a wide experience in emergency medicine, you are probably working as a quite experienced registrar in some other part of the world, or quite senior registrar, or even you are working as some junior specialist or even junior consultant in some other part of the world. You have wide experience in anesthetics, critical care, emergency medicine, obviously. You have done your exams and you have all the portfolios for your trainings of this critical care, acute medicine, and anesthetics, and obviously emergency medicine. Then you can consider going through this 3 years training program directly as a higher specialty training. So you will put your interview as a higher specialty trainee in emergency medicine. You will start as ST4, and after 3 years program, you will finish your FRChem. You can see that I've written here as Caesar CP, but you will be consultant in UK. Recently GMC has changed that if you have a 4 or 5 years training in UK, then you will be eligible for CCT. It's better getting checked in GMC because I'm not very sure if this 3 years program, only the higher specialty, will be attained CCT, but GMC might change it, might make everyone on the same line. I don't know, but it's something to be just. But this specialty program, the 3 years one, is for the people who has wide experience, and just 3 years, and then you finish your FRChem and you start as consultant. Now, as our today's conference, this is one of the burning question: how to apply for the training. So our question: how we are going to apply for emergency training. As I'm going through from this part, you will see many things here is going to be quite similar with other things, because you are going to apply a training program under Health Education England, and obviously Health Education England works quite a similar way for all the specialties to maintain its quality. So many things will you feel might that it could be quite repetitive, but bear with us, we'll go through it. So the first thing that we mentioned is the run-through training. You apply through ORIAL, and previously being mentioned that you cannot go to the round one, can go to the round two, but from last year, it's quite straightforward. Anyone who would like to apply for a training, irrespective of your citizenship status or your visa status, you can just apply in the round one application. And training for the run-through training of CTST1 starts in emergency medicine from August. And as I mentioned, the DREAM training, it again starts in August. You start as ST3 from the beginning, but we mentioned already this ST3 years works for 2 years. So 2 years you will work as ST3. You apply on the first application. There's no round two or no re-adverts for this application. And as I mentioned before, you need more exposure in emergency medicine. And historically, because the Royal College of Surgeons used to work with emergency medicine quite closely, maybe 18 or 20 years ago. So the surgical trainees or the surgical exposed people used to get some advantages on that time. But now it's like quite, they expect you to have a proper emergency medicine exposure because things have changed quite a lot recently. And the other one, which is the HST training, which goes from ST4 to ST6 training, you apply through ORIAL, you apply on the first application, there's no round two or no re-adverts, and it requires a proper extensive exposure in emergency medicine. Although many IMGs are okay to get this thing, but the number of the IMGs that directly apply for ST4 is not that big. So mostly people who does the first 3 years training like ACCS training and then take some few years off, they usually apply in this area. But obviously we know few IMGs who are successful to get this thing, but most of the people with some experience take the DREAM program. And like any other training program, it starts from August. Right, so how you actually search for the ST1, because if you search as an emergency medicine in ORIAL, you won't be able to find out it properly. So that's why there is a screenshot. I took it from, I believe, last year. Yes. So you go to the ORIAL. This is the box standard ORIAL website. You go to the ORIAL, and then you, in the area, you search for the ACCS emergency medicine. So to have an emergency medicine for 6 years training, which is the box standard or the most popular one for the junior IMGs or the junior doctors, you go to the ACCS emergency medicine, which you will find in this screen. You can see it because if you see my pointer, it's being shown here. And then you will get quite a bunch of numbers. So unless you are interested for the North Ireland one, which is mentioned on the top here, you will go through the regular one, which is which opened actually on the 2nd November and finished on the 30th November. So generally speaking, we're not going through the numbers or the exact dates here. The round one training application opens at the end of the year, which is usually at the end of the October or the beginning of the November or in the beginning of the December time. So mostly, as you can see here, it is in the November time. So here you can just, on that time when we'll be open, you'll see the green area here. You can just apply through there. And if you would like to work within England, Scotland, or Wales, then you have to be very careful. You have to choose the England, Scotland, and the Wales one. Don't go for this one. Don't go for the Northern Ireland one, this one. But if you are someone who is particularly looking forward for the Northern Ireland one, then this is the area you have to choose. Because I'm just mentioning it here now because I know few of the IMGs who actually was not aware of it and actually applied for Northern Ireland area, and even after getting the number, they couldn't join because they wanted to stay within England or the Scotland Wales area. So as you go into the application program, you will see that you will find the everything you are, I'm pretty sure if you know about ORIAL, you are quite used to with it. It actually mentions the grade name and when it is going to be commenced. And here you will see three things. One is the information, which will tell you quite a lot of information that when you're going to be having the interview, how the interview is going to be taken place. But the most important part for you now is this documents area. You can see here they have a applicant handbook, which is a fantastic one. If you read it top to bottom, you will know mostly everything of the interview process. And the personal specification, it is mostly like if you are eligible to apply for this program or not. Then you will go through the ACCS self-assessment scoring criteria, some documents required for the interview. We'll go through some of these bits so you will know. So mostly these are the primary 4 documents that you require or you need to know. So number 1 is the handbook. You can see this is the handbook. It looks like this. Number 2 is the personal specification, which looks like here, this. It just tells that what is your basic requirement and what is the requirement. If you have, you will get a better mark or better score in the interview, or previously, not in the interview, in the pre-interview scoring. In the third area, there is ACCS emergency self-assessment score that is being mentioned here, and the document required for the interview. So you will know if you are on the major of the IMGs, if they are on visa, so you have to bring your passport, your residency status, and all these things. They are going to check everything. But if you are someone who has the background information or the background experience of emergency medicine, and you're looking forward to start a DREAM program or a HSD heart specialty training program, then this is not for you. You have to search here in emergency medicine, and you will get your like this. This is needs to be emergency medicine like this. You are not going to put anything like ACCS emergency medicine for ST1 or CT1. You have to put emergency medicine, then you will get all the interviews required for the emergency medicine. So the first thing, when you apply, you need to know everything which is valid, because in this age of information technology, we get a lot and lots of information. So what we need to know is the valid information, because that is going to help you to reach your goal. As we mentioned, these documents are going to be your core information for the interview, because if Health Education England and or Royal College of Emergency Medicine bring any change, things will be reflected in these documents, mostly in the first 3, I would say. Now, this is a screenshot. You can actually see this is taken from the handbook, which is from this year and the last year things that mention the interview format, which is basically 4 or 5 boards or 5 presentation areas. So you have to be prepared for 10 minutes. You do a presentation. You will get some structural interview station, and you will ask about your interest in emergency medicine. And obviously, like any other specialty, you will go for 20 minutes in the portfolio station. So there are 4 stations mostly. One is the preparation status you have to go through. But now, during the time of COVID-19, you know that the first interview process, there was no interview process. They actually taken majority of the people based upon their pre-marks. Some people got the interview which happened before March. This readverse time, it actually go through the online interviews. So we have to keep our eyes open that what's going to happen next year. Are they going to do it through an online? Then possibly they are not going to do a so extensive one. It might be a 3 boards through the Zoom meeting or some kind of Microsoft Teams meeting. So as I mentioned on the right side, when you start, so now you have decided you have chosen emergency medicine and you are going to apply for emergency medicine. So first thing, you have to focus on your portfolio. So how you will go get a portfolio in Royal College of Emergency Medicine? It's quite straightforward. You have to pay for your portfolio. You have to just go through the Royal College of Emergency Medicine website and ask to get an associate membership, because you'd like to get trained in emergency medicine. Then it just takes like 15 days to 20 days. They will give you an associate membership based upon your application, and when you get the associate membership, you are eligible to get the portfolio. Well, you can only get the portfolio without the associate membership, but I always mention, when you get the portfolio, get the associate membership as well, because there's no changes made definitely on your financial ground, so you're not going to lose anything. Rather, when you get this associate membership, while you go to the interview, in the section of emergency medicine station, you will given some more marks regarding your membership status. There are some people who gets MRChem degree, they already get this benefits, so it's always worth taking this associate membership. And when you have developed your portfolio and you are applying, you have applied and you got shortlisted, this is the time you have to focus on these 4 areas: how you're going to do these presentations, what are the presentations quite common, what kind of structural interview stations you're going to face, and all these things. You have to make preparation for this thing. Then you're not definitely working on your portfolio station, then you're only working on the other 3, which will give you more mark. So the thing is like how to prepare for the portfolio. As we mentioned, that the first thing we have to prepare for the portfolio. So the handbook that I mentioned, which you will get in the Oriel website, is something to follow. Otherwise, I developed some of my personal experience from me and from some of my colleagues who all are IMGs and all are in different stages of training. Some people has already finished training and working as consultant. Yes. So having the first thing, as I mentioned, that so basically these are the things that I actually mentioned previously. You have to go through the things which is actually written in the handbook, and mostly this ALS, ATLS, and APLS course. If you can do it before, this is something fantastic. And the second tips that I'm going to give is, if you don't have MRChem or FRChem exam done, at least book for the exam. You don't need to sit for the exam. Book for the exam before you go for the interview. That will give you quite a lot of marks. So the interview I mentioned, there are 4 stations. 1 is presentation, 2 is the clinical scenario, 3rd is the emergency medicine specific station, and the 5 is the portfolio station. I mentioned a blog in emergency-medicine.com, which is in the end of my presentation. I mentioned quite in depth what I went through there. So if you're interested, you can go through that website. You will know more, and you can ask me directly there. To sum up, so we have these are primary things. You have to have a portfolio. You need to know what are the changes coming in the Royal College of Emergency Medicine, and you have to have your Oriel account in the number 1 and have to check what are the interviews and what are the documents there. Just to give you a glimpse of idea, as I mentioned on the beginning of the presentation, that there are subspecialties. So at this point, emergency medicine, there are 2 subspecialties. One is the pediatric emergency medicine, and one is pre-hospital emergency medicine. If you are interested in either of these things, you can extend your training for 1 year each to get these 2 subspecialties. For pediatric emergency medicine, you're not going to give any more exams. You just have to go through the interview and 1 more year training. For pre-hospital, you are going to give 2 more exams. One is a diploma to a diploma exam, and the other one is a fellowship exam for the 1 year to get it for the pre-hospital emergency medicine. If you have any interest in it, these 2 specialties are fantastic. Feel free to know more from the Royal College website. So, well, that is all mostly. If you have, I mentioned that I maintain a blog which is here, emergency-medicine.co.uk. I wrote few presentations there. You will find even this slideshow over there. If you are interested, if you need to know more about it, feel free to knock me in Twitter or through the website. I'm always happy. Or you can ask Aman through the emails that he mentioned. Aman can pass the message to me. Thank you very much. So off to the panelist team.
Brilliant. Thank you, Nehal. Very, very comprehensive. A lot of detail to get into a short period of time. We recognize that, and it sounds like you've covered a huge amount. There are a lot of questions come through, Dr. Sarja, so I'm going to forward those all on to you, if that's okay.
Yes, that's fine.
Would you mind just trying to answer, because there's some quite specific ones, I think, for specific situations that would be important to get an individual answer for. So we'll forward them all on. And then thank you so much, because that was very, very comprehensive and very useful.